This video is for people who want to understand the difference between endoscopic spine surgery versus open spine surgery. If you are watching this video, you have likely had years of back and/or leg pain, been through physical therapy, and even had spinal epidural injections. The next step is minimally invasive spine surgery. You may have seen doctors with differing opinions, some recommending spinal fusion, some recommending discectomy, and it may seem like every doctor calls every procedure minimally invasive spine surgery. In more rare instances, you may have heard about endoscopic spine surgery, which was previously known as laser spine surgery, which is truly the smallest and least traumatic of all the spinal operations. Let's make some sense of this. First, open spine surgery is the largest and the original of the spine operations, and very often is a spinal fusion, which your doctor places permanent screws and rods in the spine. Second, there is a decompressive spine surgery, such as discectomy, laminectomy, and microdiscectomy. All three of these are incisions made and dissections to expose abnormal parts of the spine, and removal of abnormal tissues with various medical instruments. There are three key reasons that are thought to cause this scar: air touching nerves, dissection, cutting of tissues, and coagulation, burning of tissues, to stop bleeding. These variables and others can lead to scar tissue formation in the spine that can harm the same nerves and cause pain that original problem did. This scar can take up to 2 years to slowly grow in. Third and newest is endoscopic spine surgery. This is an 8mm tube inserted through a very small skin incision, then directed into the abnormal tissues. This creates the very least trauma. An endoscope is inserted in this cannula, and miniaturized instruments are used to remove the abnormal tissues and free up nerves. This endoscope has continuous fluid irrigation, thus no air, and drastically less dissection and coagulation. This translates into much less or no scar tissue growth 2 years later. The most significant of these issues is the scar tissue formation after open spinal operations. To understand this is a normal spinal canal where the nerves live. This is the scar that can grow anywhere the doctor dissected. Let's summarize this. Endoscopic spine surgery, open spine surgery. Minimal to no scar. Scar tissue occurs against nerves. Post-op pain for up to 9 days. Post-op pain up to 6 weeks. Extremely low infection rate. Infection rates 2 to 5%. Minimal trauma. Significant trauma. No hardware. Hardware stays. For fusion. Minimal blood loss. Blood loss ranges from 100 to 7,000 milliliters. No change in spinal motion. Fusion limits spinal motion. Although all of these surgeries have a place, the key is to get the least invasive surgery to get the job done. This helps to minimize your risks for the future and to have less trauma and less pain. The least invasive spine surgery is endoscopic spine surgery. Not surprisingly, it is the newest and a little hard to find a doctor with this expertise, but well worth the effort. This is brought to you from Michigan Pain Specialists, Ann Arbor, Michigan.